Welcome. Tonight, we travel not to a battlefield or a throne room, but into the hushed corners of medieval towns, where pain and healing walked hand in hand. You'll discover the eerie calm of the surgeon's bench, the sorrow carried by plague doctors, the dusty secrets of ancient cures, and the soft luxury of healing in noble chambers. This is a story of medicine before medicine, of strange tools, whispered prayers, and wounds treated with wine and fire. It may be grim in detail, but gentle in telling the calm walk through the dark corridors of the past. So lie back, let the modern world slip quietly away, and allow yourself to drift into the deep, strange hush of history. Walking slowly through a narrow, muddy street, children play near puddles that shimmer with strange colors. In the distance, you hear a steady tapping sound, wood against metal, sharp, deliberate. There were no sterile gloves, no anesthetic, no painkillers beyond a stiff drink, and no expectation that you would walk away without scars if you walked away at all. Imagine yourself. The air is thick with the scent of livestock, smoke, and sour wine. Was enough to empty the stomachs of onlookers. You follow it to the town square, where a crowd has gathered, the hiss, and the bleeding, and the fever, and the flies. Then you were considered lucky. Many did not. Instead, for women, labor could mean hours of agony with no trained assistance. Midwives did their best whispering prayers, using herbs, tying charms to ankles, but many mothers and babies did not survive. They were packed with moss, honey, or animal fat. Infection wasn't understood not by name, but people feared the signs: blackening skin, strange smells, cold sweats. They called it the rot, bad humors, or a punishment from God. The smell. Silence. In the center is a cart. On it stands a barber-surgeon, a man in a blood-stained apron, sharpening his knives on a long leather strop. Their instruments were simple: knives, saws, forceps, curved needles, hot irons for cautery. Cleaned with wine, wrapped in cloth, and left to fester. Or nothing at all. Perhaps a gulp of beer, or mulled wine if you were lucky. Two men might hold you down, but it was always near. Accidents happened often. Fire, animals, work injuries, fights. There were no helmets, no antiseptics, no soft landings. When things went wrong, you went to the man with the knives and hoped. The surgeon would mark the skin, steady his hand, and begin to cut quickly, before you could faint or panic. This is where your treatment begins. People endured. They trusted in remedies. In that square, the faces in the crowd already turning away, in rituals and the steadiness of the surgeon's hand. In medieval Europe, if you had a deep cut, a broken bone, or an abscess that needed draining, you didn't go to a hospital. Surgeons were not revered professionals. They were craftsmen, often barbers by trade. Their tools cut both hair and flesh. If you had an infected leg, swollen, red, and foul-smelling, the diagnosis was often simple: amputation. You would be given a leather strap to bite down on. The bone saw followed, a jagged rhythm of grinding teeth on bone. The sound alone, they said. Then came the cauterizing iron, red hot, pressed against the wound to stop the bleeding. It was over. If you survived the shock, perhaps, will be remembered. Even the most routine treatments were fraught with risk. Toothache, the barber might extract the tooth with iron pliers, sometimes breaking the jaw in the process. Broken nose, realigned with a thumb and a grunt, head wound. Wounds were rarely stitched. Even childbirth was dangerous. And yet, surgery was not daily. Let your thoughts linger now. The saw is rinsed in a wooden bucket. The cloth wraps again. The next patient waits. And you. The year is 1347. You are standing near the docks in a bustling Mediterranean port, perhaps Messina or Genoa. The sea smells sharp, and gulls wheel above the ships. The crew of a merchant vessel stumbles ashore sickly, hollow-eyed. Some fall where they stand. Soon, a quiet panic spreads. People whisper of a great pestilence, a sickness from the east. Punishment, a curse, not here. And then the dying begins. This is the story of the Black Death, the most devastating pandemic in recorded human history. But it is not the story of numbers or timelines. Instead, we follow one man, a figure not of myth, but of grim necessity. You are now behind the mask of a plague doctor. The costume is heavy. You wear a long leather overcoat, waxed against moisture and disease. Your hands are gloved, your feet wrapped. Over your face is a long beaked mask stuffed with herbs, rose petals, and vinegar-soaked cloth. The skin bruises, blackens, cracks. Breath becomes shallow. Consciousness flickers. The scent is sickly sweet, meant to block the bad air. In your hand, a stick or staff, to examine the sick from a distance. To prod the body. To keep the desperate away. You move from house to house. Doors are marked with chalk. Some are silent, others cry out in agony. Most have fallen into eerie stillness. Inside, the symptoms are always the same: fever, pain, swelling under the arms, at the groin. Sometimes they beg you for help, sometimes they simply stare, and still you keep walking. By 1351, the plague had claimed as many as 1/3 to 1/2 of Europe's population. It moved faster than armies, faster than sermons, faster than the living could bury the dead. Began to suspect that proximity and contact might play a role. Bell towers rang and rang until ropes frayed and bells cracked. Trade stopped, courts were silenced, fields went untilled, even kings retreated into seclusion, afraid of the very air. Whole villages vanished. Priests could not keep up with funerals. Cities like Florence, London, and Paris descended into mourning. Among the living, explanations varied. Some said the stars had turned, that Saturn and Jupiter had aligned in a cursed conjunction. They had stared into the abyss and learned to endure. The herbs are withered, the wax cracked. His services are no longer needed. Others blamed sin. Flagellants marched through towns, beating themselves with whips, crying for mercy. Still others blamed foreigners, outsiders, or the poor. Pogroms erupted. Suspicion ran deeper than disease. But a few, a very few, they noticed that doctors died, priests died, entire households fell altogether. Quarantines were attempted, ships were held offshore, markets closed. It helped, but only slightly. Still, through it all, life, somehow, continued. The dead were buried in mass graves. The fields returned to green. Children were born. Songs were sung. Cathedrals reopened. The plague would return again and again, but never with the same ferocity. Its survivors were often changed, scarred by memory, haunted by silence, but also strangely hardened. And the plague doctor, he hangs his mask at last. But when he closes his eyes at night, the moans and coughs and cries still echo faintly. In time, they will fade. Now, drift quietly through this world. Let the black flags lower. Let the church bells grow silent. Let the lanterns go out, one by one. And in the hush that follows, know that the storm has passed. Let your mind drift now, away from the chaos of plague, to the quieter corners of medieval healing. You are in the stone-walled apothecary of a small monastery. The room is dimly lit by beeswax candles. The scent of dried herbs thicken the air. Illness is explained by the four humors of the theory, inherited from the Greeks and expanded by Arabic physicians. Shelves grown with jars of powders and leaves, roots and oils. Clay bowls hold mixtures of unknown composition. Everything here is meant to heal, but not everything is harmless. Welcome to the world of medieval medicine, where magic and science, prayer and poison, often walked hand in hand. He reads from a copy of Galen, scribbled in Latin, updated by Persian scholars. There is no germ theory here. No understanding of bacteria, no knowledge of viruses. He mixes powdered bone and cinnamon bark into a honeyed brew. Your body, it was believed, was a balance of black bile, yellow bile, blood, and phlegm. Sickness came when one of them overflowed. Too much phlegm. You were sluggish and cold. Take hot herbs. Too much blood. You were feverish. Time for bloodletting. In the monastic infirmary, a monk leans over a sick patient. He prescribes a warm compress of goose fat and crushed lavender. Sometimes he prays. Sometimes, he bleeds the patient. Sometimes, he does both. Outside the monastery, cures grow stranger. A fever under Virgo might require cooling herbs. Under Aries, bloodletting. Of course, their remedies were learned by trial and memory, passed down through whispered instruction, not books. In villages, toad powder is a common cure. So is roasted hedgehog, ground pearls, and burnt snail shells. For epilepsy, one might inhale smoke from burning peacock feathers. Wooden boxes lined with dried herbs, mortars stained with resin. One kit found in York contained. For a persistent cough, fox lung was boiled and drunk. For headaches, a dried mole might be tied around the neck. Astrology also played a part. The moon's phase, the position of Mars, even your birth sign, all were consulted before prescribing treatment. Midwives and herbal women often knew more than the physicians. They used willow bark for pain, yarrow to stop bleeding, valerian root for sleeplessness, trying to help, to soothe, to save, often failing, but always trying. But too much knowledge could be dangerous. Women who healed too well, who gathered strange plants, who muttered charms, they risked accusations of witchcraft. Some vanished into prisons, others into silence. Even leeches, grotesque as they were, had benefits, helping with blood flow in infected tissue. Archaeological digs have uncovered their secrets. Bronze surgical kits buried with bones. A curved knife, likely for draining abscesses, a bone needle for stitching wounds, a metal catheter used. Carefully small pots for salves, one still faintly scented with frankincense. There's quiet dignity in these tools. They tell a story of people trying, and yet, some treatments worked. Garlic poultices could fight infection. Honey kept wounds clean. Mint helped with nausea. Perhaps not all was guesswork. Perhaps some was wisdom in disguise. Now imagine the world slowing again. The candles in the apothecary burn low. The mortar is silent. The scrolls are rolled and tied. And outside, the wind picks up gently, carrying the scent of crushed mint and dried thyme, and the strange, enduring hope of those who tried to heal. Let the scene change now, from smoky village huts and herbal cottages, to stone corridors draped in tapestries. You find yourself inside a castle, its thick walls muffling the outside world. Perhaps a lady, either way. The rhythm of the household has shifted. Candles burn even in daylight. The fire is kept constant. Doors creak open slowly and close even slower. The air is cooler here, perfumed with beeswax and lavender water. A hush lies over everything, the kind of silence that gathers around illness. The patient lies beneath fine woolen blankets, head resting on soft pillows stuffed with goose down. One of the nobles is unwell. Perhaps a lord. He does not rush. He listens to the pulse. He examines the patient's urine by sight, smell, and sometimes taste. He may even chart the stars before offering advice. You are now in the sickroom of the elite. This is not the filth of peasant streets. Here, linens are clean. The straw is fresh beneath the feather mattress. Musicians are sometimes summoned to play softly. Lutes or harps to soothe fevered thoughts. The ability to rest. Time. Privacy. Light. Even the fire crackles gently, tended by servants trained to move in silence. Pages were turned with trembling fingers. Psalms whispered between bouts of coughing. It was as much a spiritual illness as a physical one. Decisions paused until her health returned. A royal matron might call for her confessor or for her steward to settle household disputes. While she lay ill, her voice, frail as it was, still held weight. A personal physician, likely trained in one of the great universities like Bologna or Montpellier, attends with quiet precision. The remedies offered here are complex ingredients from far-off lands, curtains drawn, candles snuffed, doors sealed until morning passed, ground ambergris, imported cinnamon, dried rose petals from Damascus. Potions are sweetened with honey and infused with powdered gold leaf. You've journeyed through the chambers and corridors of a world not forgotten, but often left unspoken. If the illness lingers, a pilgrim is dispatched to bring back holy relics, or perhaps a prayer scroll from Canterbury. The patient is never alone. Attendants whisper. A favorite dog might curl at the foot of the bed. stirred the ancient herbs of long-dead apothecaries, and rested in the silent rooms of kings and queens. And yet, for all the care, the outcome is no more certain than in the poorest village. Many noble families kept books of hours, illustrated prayer books, by the bedside, to be read in times of danger. The fear of death was always present, even among the wealthy. But there was also hope, and more hope, perhaps, than most had, access to rare treatments. O noble women, illness sometimes offered a strange power. A bedridden duchess might receive letters from across the realm, and sometimes healing came, slowly, with time, as the fever broke. The windows were unshuttered, muslin veils lifted from the bed, light returned. But for every recovery, there were rooms that fell quiet forever. And even then, life resumed slowly, as though illness had only been a guest, not a shadow. Let your thoughts now ease into this chamber. The firelight flickers. The shutters are drawn. The wind outside whispers gently against the stone. Somewhere nearby, a book closes with a soft thud. The sickness has passed. And now, dear listener, you've stood beside the surgeon's cart, walked the plague-ridden streets. You've seen the strange, gentle, desperate art of medieval healing, not as a horror story, but as a human one. May this quiet passage through time ease your mind, slow your breath, and carry you into peaceful rest. Until next time, sleep well.